Just so we are recording. I would ask that, looks like almost everybody already is, but if you're not, please make sure that you mute your phone lines just so that we don't have any background noise. We are also going to ask that you keep any questions until the end. So Dr. Herrold's going to speak for about 45 minutes, and then we'll have about 10 or 15 minutes for question and answer. And as she's noted a little bit earlier, she's also happy to take follow-up questions via email. So her email address is here, and she'll display it again at the end. So if you have any follow-up questions that you don't have a chance to ask or you think about afterwards, feel free to email her. But at this point, we're just going to turn it over to Amy.
All right, great. Thank you so much, Brooks, for the kind introduction. Thanks, everyone, for joining. This is really great. So as Brooks said, I currently have a VA Career Development Award, and I had a past Merit Switzer Grant Award. So just giving you some of my training grant credentials here at the beginning to illustrate those things to you. I actually started out, though, my degree is in neuroscience. I started out in a biomedical neuroscience laboratory, and I started my grant writing experience early. I successfully obtained an F31 NRSA from NIDA during my graduate work to study rodent models of co-occurring addiction and mental illness, which is kind of a common thread that has gone on. But it was in my postdoctoral work where I transitioned to studying clinical neuroscience, and I work with Teresa Pape, who's also based at Hines VA and Northwestern, and she's been my primary mentor throughout this process. So I am in the last year of a Career Development Award. I also serve as a co-investigator on 2 of Dr. Pape's Department of Defense grants, but I am in that period of time where I'm doing the grant hustle again, applying for anything and everything I can get my hands on. So I'm happy to take questions on that transition period as well as training grants at the end. So first I'll go through some of the different training grant mechanisms or options. The 3 main federal flavors we have through the NIH, the VA, and NIDILRR, which would really serve best this rehab audience. I'll talk about preparing for grant writing. A lot of homework goes into the phase before you actually do any writing. I'll talk about the career and training plan, the mentoring team, the mentoring plan, and some grant writing strategies. And these things I'll speak specifically the most about my VA Career Development Award grant writing process and what the tips and tricks I learned during that phase. But these lessons learned are really applicable to any type of training grant that you're applying to. Then I'll provide some additional grant writing resources. And then finally, another resource are these advanced fellowship opportunities within the VA system. The VA is an intramural research body, and I'll go into a little bit about that more later. But these postdoctoral advanced fellowship opportunities are really an amazing resource. There's a lot of them, and I'm going to go into those at the end. So first, going through the NIH option, their training grants are termed K Awards, and we have a link here to some more information about that. But one thing with the NIH is that there are many institutes, and in the next slide, I'll talk about the many flavors of K Awards. So the first thing you want to do in aligning what your project idea, what your training grant, and where you want to be with your career is aligning all of those things with the right grant mechanism and the right institute. And you want to see if the institute you're interested in applying to has the mechanism of K Award that you think is the best fit for you. So you want to, as with any grant, read the instructions carefully to see if the eligibility aligns. Another pearl of wisdom that's true for any training grant, not only NIH, is all of the application sections must be strong. You may hear from the past that the research section doesn't need to be as strong because you're still in a training phase. You know, that may be true to some degree, but everything needs to be really strong. In the past, it may have been, oh, we know that this person is coming from a really strong lab or a strong environment, so we know the research plan will get there if we give them the money because they have great mentors. Now, someone may be reviewing the application and say, this research plan isn't really as strong as some of the others. We're saying, why isn't that mentoring plan or that mentoring team that is really strong mentoring them right now to make their research plan really strong? So everything needs to be strong. Things are getting more and more competitive as time goes on. So the other tricky thing about training grants is that you need to balance what a great applicant you are, what great potential you will have with you still needing support in a training grant mechanism. You don't want to oversell yourself and say, and that the folks and reviewers may say, why aren't you applying for an R01 already or something of that nature? You need to show that you have a lot of potential, but with this specific training grant, you need some essential skill sets or add things to your toolkit, and you have mentors aligned that are going to help you do that. Another thing about K awards here, but is applicable to all training grants, is that the K should not be the end of your research career, it's the beginning, right? So you want to show that you're going to be a successful independent researcher and launch this career after that training grant. So you need to show you have long-term vision as to where your research is going to go. You need to make clear here for the NIH, you know, what is the thrust of your R01 proposal? How does this K award going to set you up for that R01 that you're going to apply for in the last year or two of that K application? So next, the K award mechanisms. As I said, there are a host of flavors of these types of mechanisms, and this can be pretty overwhelming. This will be different in terms of your background, your training, if you're a clinician primarily or a research primarily, and where you want your career to be. So this is going to be very specific to the individual. So I think the first step, if you think you would like to apply for these, is really think about yourself and where you want to be in the next 5 years and your background and training, and take a look through this website here, the K kiosk for K awards, and see what aligns best. And talk to maybe your potential mentors and then your NIH program officer, and see if that alignment makes sense. So moving on to the components of the K awards. First, we have the specific aims page, which is going to be arguably one of the most important features of any grant, not only training grants. So it's great to get an opportunity to learn how to write grants at this phase. You know, that's a page that you're going to want to spend the most time on and you're going to get the most opinions on. There are some differences, opinions on how to inject information about your career or professional development within that aims page. I wouldn't recommend making a professional development an aim. I think the aims should be research-related aims. However, there are some places where you can talk about your career development within that aims page. One place that I think makes a lot of sense is the paragraph that comes after your aim statements is really geared towards addressing impact of your work. And in that aim state, or in that last impact paragraph, you can talk about how this achieving these aims and successfully carrying out this research plan will set you up to be an independent investigator to study XYZ in field XYZ. So I think that's a nice place to really shed light a little bit on the career development or training aspect of the grant without going overboard. But I really suggest reaching out to your mentors that you're going to have on board with this team in their opinions on this. So then we have the next part for K awards is the candidate information and research strategy combined, which is 12 pages, and that really makes up the meat of the application. Then you have a mandatory training and responsible conduct of research, statements by your mentors, co-mentors, consultants, and contributors, which is 6 pages, the institutional environment, the commitment to the candidate's research career development, that's 4 pages, and then a new biographical sketch. Now, the NIH biographical sketches, it feels like they've been changing every 6 months, but the biggest change happened maybe 3 years ago or so, where there was a change from listing every single publication to a new Section 3 of contributions to science. And I think this can be initially pretty intimidating for early career researchers, because you may think, what are my contributions to science? I'm just starting out. But the best advice I've heard about this was at a training grant or a grant writing workshop conducted at a society meeting that I attended by the NIAAA Institute. And the program officers there really suggested for early career folks, this is really a place where you can weave together a story of your biosketch. You may be studying different research areas. As I spoke about at the beginning of the talk, I was doing basic biomedical neuroscience, and graduate work, had a number of publications in that area, then made a transition to clinical neuroscience. So that's where I can kind of parse out, but weave together my different areas of work. So this is an area that is nuanced, but it was, I think, at its inception, meant to help early career investigators, because your gross number of publications, which aren't going to be as high, isn't really, highlighted out there anymore. You instead have a link to all of your publications, and in setting up that link that's through PubMed, that is a little bit tricky and takes a little time the first time you do it. I have some separate slides and information about that, so please feel free to email me about that as well if you'd like. But it does take time, and overall the biographical sketch takes a lot of time. Don't shortchange this part of the application, especially for training grants, especially if this is their first time putting together a biographical sketch. It takes a lot of time, and you want to have a lot of people read this. The mentors on your team, and then maybe a senior person in your department would have a good fresh set of eyes to see how your biographical sketch stacks up. And another final note on this, you want to make the personal statement, the first paragraph of your bio sketch, really tailored towards your grant, not just a standard personal statement that's going to be used for every grant you submit. You really want to tailor it to the grant and take a lot of time with it. So some other things to keep in mind as you're selecting things within the NIH to apply to, and maybe coming towards the end of training grants, is that there are some different new investigator and early stage investigator statuses that the NIH honors. So new investigators are investigators anywhere on their time in their training that have had no previous R1. If you are the PI of a R21, you would still be eligible for this status. And last I heard, this gives you about a 5-point bonus on your impact score. Now, the early stage investigator status is within 10 years of your terminal degree. It's not clear exactly what the percentage or the bonus points, if you will, that this would grant you, because this changes based on the institution. So for example, NIAAA, which I mentioned earlier, which funds alcohol work, they are funding early stage investigators. They're trying to fund them at the 25th percentile. And that's a big deal, because if you're not an early stage investigator, you're going to be funded at about the 10th percentile, I believe. So that's a big jump of 15 percentage points. Now for NINDS, I just submitted an R1. to that institute about a month ago, and I was told in speaking with my program officer there that they are funding early stage investigators also at about the 25th percentile. So these are big deals, and also it's a big deal in thinking about when you're coming off of your training grant, are you ready for an R21 or an R1? I think if you're trying to go in for an R21, these are very competitive. You don't have these advantages. So for an R21, you would really want to be applying for those if your idea is super innovative. That's what those funding bodies are trying, or that's what that mechanism is for. And also if you have maybe not as much preliminary data. R1, you need that preliminary data to be competitive. So that's kind of the distinction there. There's both of those, putting in both of those applications is a lot of work. So you want to really evaluate which one mechanism is the right one for you. So just some things to keep in mind. So then moving on to VA options. So the VA, for those that may not be as familiar, is an intramural research program that has 4 different arms. The Rehab Research and Development arm is the one where I'm funded by, and the one that maybe many of you in the rehab audience would be interested in being funded by. There's also the Biomedical Laboratory Research and Development arm, that's preclinical science. Then there's clinical science, R&D, and then health services research, R&D, which many of you may also be interested in. So the VA Career Development Awards, it's a lot simpler. They only come in 2 flavors. So there's the CDA-I, which is 2 years, that's salary only. So this is works for when you are, you know, in a postdoctoral fellowship or about to come off a postdoctoral fellowship, and your research really aligns with your primary mentor, such that you're maybe analyzing data that they already have, and so forth, because this grant does not come with extra money to use for your own studies. So you're really using some other data in order to complete your research plan. You can have some training money and travel money to address your training plan, but it really, there's no money for conducting research studies. Then the second flavor is the one that I'm in my last year of. That does fund your salary at 100% plus $65,000 a year for study-related expenses. So the other thing with the VA being an intramural research program, if you're not already a VA investigator, you don't necessarily have to be when you're applying for a VA Career Development Award, but once you get it, you need to spend at least 5/8 of your time, and this is going to vary depending on which of the 4 branches you're going into at the VA. So for rehab research and development, you need to spend at least 75% of your time on your career development award as a VA employee. So then the other 25% you could be at a university or what have you. If you wanted to be, for me, I'm 100% VA, and then an extra 10% or so at Northwestern on top of that. And that 8 thing, the VA just divides their time in 8s. So the 5/8 is kind of the magic number of your time distribution that you need to maintain in order to be a PI of a VA grant. So for me, I'm interested in maintaining that 5/8 VA status to apply and for VA merit grants, for example, which would be the R1 equivalent for the VA. And also to speak to that too, if you're coming in from outside the VA, you definitely want your application to be VA-centric or veteran-centric, and your mentors need to be in the VA. If you have collaborated or know of VA investigators, there's a lot of quirks to working within that system, so that is only going to help you if your mentors are already within that system and understand it and can guide you and mentor you through it. So then the NIDILRR options. So many of you may know this. NIDILRR used to be NIDILRR and part of the Department of Education. Now it's NIDILRR and part of the U.S. Department of Health and Human Services, like the NIH. I know Kate Miller from NIDILRR always gives a wonderful talk at the ACRM Early Career Development course, where she highlights these fellowships as well and what NIDILRR is all about. So I really recommend attending the Early Career Development course and hearing about the funding opportunities from the different program officers. So the NIDILRR Switzer fellowships are a little different because the funds are completely discretionary. The award amount, I think, right now is about $75,000 for 1 year and a 1-year no-cost extension. The money comes directly to you, not your institution, and it is very hard to get around. So really, this grant works best functionally if it's funding your salary. So you may have a project that you already have data collected on or something where you need your salary funded to complete it, and that's it, no study-related costs or what have you. This money also functions very well to attend conferences. I was able to attend a lot of conferences that I wouldn't have been able to attend if it weren't for this grant. Really, and this is important for early career researchers that really need to network and get their research out there. So travel funds are very hard to come by, harder to come by as time goes on. So having this discretionary money was really great for being flexible at covering travel costs. So that was really helpful. Your research area that you proposed must be in line with the Rehab Act of 1973. This is a huge importance for these grants. There are 2 flavors of Switzer fellowships. There's the distinguished, and for that, you need to have at least 7 years of research experience in the subject area. And for merit fellowships, you can be a doctoral candidate even, maybe completing your doctoral work, or you can have some other terminal degree and you can have less than 7 years of research experience. So now that I've gone through these different funding bodies, we'll start to talk about getting prepared to write the grant. I've talked a lot about kind of aligning your eligibility with that of the institute, and you want to always reach out to any program officer that you may at that institute in order to really make sure everything is alignment. And once you have a fleshed out idea of your specific aims page, you want to talk to them too. It's really best when you approach program officers to also send them a prepared specific aims page or abstract so that you really have something to talk to them about. That really helps them a lot to make a productive conversation. You also want to start thinking about who is your audience. The institute, we already talked about that, but also the specific study section that's going to review your grant. So you want to try to start to identify that, because you can, for the NIH, make a cover letter to direct them as to what study section you are going to be submitting to, or that you would like to have review your grant. You also want to ask colleagues to share their successful submissions. So I think we're in a more sharing culture these days, and I've had a lot of great luck with this, but you are asking for something really personal when you ask for a submission or an example grant. So you want to do that with a lot of diplomacy and so forth, and you want to keep whatever they give you confidential. If you can't get your hands on something successful, maybe you can get your hands on something that's close to successful, and maybe a copy of that person's summary statement or grant critiques, where you can see maybe where that applicant went wrong and learn from their mistakes too. And not only are sharing grants a very personal thing, sharing summary statements is an even more personal thing. So, you know, that doesn't mean you shouldn't ask, but just be sure to keep things confidential and approach them with a lot of respect and grace. The other resource that I really adhere to a lot is this grant application writer's workbook. There was a new issue of that in 2016 that really, really helps me structure grants. It has a lot of great resources, and I apply these lessons that are illustrated here not only to NIH applications that I'm submitting, but also to VA. So I think that, you know, it's just a wealth of resources. It takes you through the grant writing process step by step. It's really wonderful. Another resource is NIH Reporter. Again, if you're, you know, vacillating on what's going to be the best institute to fund your work, this is a great place where you can put in your keyword searches for your area that you're interested in studying, and then you can, it will populate with who has been funded in the abstract for that grant. So it'll give you a good idea about where you could also get funding for your work. So moving on to the career and training plan. One thing about writing training grants is that a thing that's difficult about them is that there's so many components. There's the research plan that's a part of every grant, but there's also this career or training plan, and there's a mentoring plan, there's all these letters of support, the bio sketches, all these things. And that's why I have this bullet point here for keep it organized, because if you're changing one area of the application, this could really have a domino effect on the other areas. So you want to keep track of what things you say where, and the different parts of your application need to mirror each other and handshake with each other and complement each other. One tactic I use, which I'll give you a few examples in a minute, is using pictures or diagrams. I'm a very visual person, and grant reviewers are, you know, very tired people. They're reviewing several applications at a time. You want to make your application stand out, and I think one way is making very clear, easy to read diagrams that bring different concepts together. Another aspect of this career and training plan is you want to be very detailed and specific. You need to talk about what specific workshops, what courses, what seminars you're going to go to, when do they happen, what part of the aims of your research plan do they address and help you be a better scientist to understand? And will these workshops, courses fit in with your budget? You know, everything kind of works together. You want to integrate this section with all other sections of the grant. You know, will mentors guide you in one aspect of your training plan while others guide you in another area? And then the end goal of all this is that it's going to set you up for your next steps to be an independently funded investigator. So this is an example of one of these diagrams that I made for the career plan to really bring facets of the application together. Bringing together the mentoring team, the research products that are going to come out of my grants, the training activities, the different areas that they come under, and the funding that I'm going to seek with this application. Starting with the Career Development Award 2, this is from that application of mine, and what are the subsequent funding that I'm going to be seeking. So the next part in bringing this together in this section of my application was really putting together a Gantt chart of how the research plan is going to fit within the mentoring team with the general areas of training activities, making research products, and then getting that funding support. So before we have kind of a schema of how these different areas of the application come together in the career plan, but then here, this is how this is all laid out in time. And you want to start to get more fine-grained in this because you want to illustrate to the reviewers that this is what you're proposing is feasible. That is one of the most common critiques for early career investigators and training grants, is that what you've proposed is overly ambitious. That's something that I'm still struggling with as a researcher, is nailing down the right scope of a project. So I think that's a common hurdle. So I'm going to flip to then a table I have here of the specific training activities from this section of my grant. So you can see here, I'm getting really specific with what different activities I'm doing and when I'm doing them. I have the quarter and the year they're happening, where they're happening, and what mentoring team is going to help me out with guiding me in this different activity. All right. Flipping back again. All right. So now moving on to the mentoring team. Who do you choose and how big is too big? So this is a really important element. Maybe one of the most important elements of the grant is finding a great mentor. So you want to choose someone who is really going to help you with your every aspect of your career and your research plan. And I hope too that the mentoring team grows in a nice snowball effect. You want to match out your research plan and kind of the content expertise that it takes to carry that out with your mentoring team. So you want to make sure you have a strong mentor in each area. So you want to also try to make it lean and mean. Don't do what I did. I had 12 mentors, and I'll show you in a minute on how I managed that. But I did get that as a grant critique. And then my primary mentor really had to talk about how she was going to help me manage such a big team. So, you know, it's a difficult area to straddle, but it's really probably going to snowball from picking that primary and secondary mentor that are going to be super key. Those are the people I talk to all the time about aspects of my career and aspects of my research plan, and they're really great too. If they don't have the expertise, they'll say, reach out to so-and-so on your mentoring team, or reach out to so-and-so in the field and build a new connection. So I really hope that this is a nice snowball effect for you all as well. But don't let it get too out of control, because that can be overwhelming too. So also letters of support. This is a big deal as well for the mentoring team. You need to be a great colleague. You want to ask well in advance. You also want to offer to draft a letter for your mentor. Things will probably be better because you will know the details and remember the details of your relationship with them and how that relates to your research project and your training better than they will. Because they have a lot of other things going on. They probably have a lot of other people they're mentoring. So it's really going to help if the first draft comes from you. But then in the end, you want the letter to sing in their own voice. So you need to set up with your mentor how to make that happen. You know, with my mentors, I usually come up with a really strong first draft for them and then give it to them well in advance so that they can tweak it and make it in their own voice. And then we address the letters of support in other meetings, or we call each other to kind of round things out if there are any other questions. So kind of the main topic, it can be overwhelming to kind of draft these for the first time. So kind of the general topics you want to include in this are the expertise of the mentor, why they're qualified to commit to your mentoring team. This is going to be complemented by their bio sketch. Then you want to give that nice story, how you met them or how they came to know you, in that how you displayed your great potential as an independent investigator to them and so forth, really create that narrative. And that's why it kind of is better if this specific part of the draft especially comes from you. You want to highlight things like co-authored publications. This could even be posters you've worked on, symposiums you've presented on together, all the work that you've done together, any interactions you've done together, you want to highlight them because you want to demonstrate to the reviewers that you guys really know each other. And then finally, you want to be specific on what they're going to do and what their contribution is going to be for your project. This is very important. You don't want to just ask someone to be a mentor without having an idea about how they're going to contribute to what you're going to do. You need to have a title for their role, what their expertise they're going to provide. are they going to give you access to resources, and their percent effort that they're going to provide on your grant. So as I mentioned, I had 12 mentors and consultants. This is very crazy. Don't recommend it, but I did make it work. And this is one way I was able to do it, is that I really divided this into mentoring teams. And this is the first paragraph of that plan based on the aims. So in each phase of time, I'm really dealing with 3 or 4 people. So that's what helped me in kind of herding the cats, if you will. And then we had to write a lot of stuff about how Teresa was going to help me herd those cats too. And also illustrate her success in really conducting team science, where you need a big interdisciplinary research team. So that's kind of how we sold that. So getting back to some of these common critiques, as I said before, overly ambitious is kind of the #1 thing that early career grants get critiqued on. Also, the specific aims being too interdependent. You know, you don't want to build up a house of cards so that if aim 2 or if aim 1 especially fails, you don't have anywhere to go for aim 2 or aim 3. You want to make each aim deliver something meaningful, whether or not it goes right or wrong. And this is a hard thing to do. So this is where your mentors will come in with a lot of help, I hope. But not to worry, everyone has this struggle. So I want to illustrate here too, after you've submitted your application, and you probably will have to resubmit, you're going to be in a lot of good company there, how I dealt with dealing with these critiques. I made a series of tables for the summary statements, organizing them by the different reviewers, 1, 2, 3, and then the general discussion. And then kind of summarizing, was everything, was this a common critique that was happening for all the mentors or all the reviewers, or is this something one reviewer had that another reviewer didn't have? So this is in my last set of summary statements. So by this time, really the only place where people had additional critiques, which I think is common to most people, is that people are still nitpicking at your approach in the research plan. So these are kind of how I was able to organize that to make it a little bit easier to distill down. Another thing is, when you do a resubmission, you're going to have an introduction to the application where you're addressing all the reviewer critiques, and organizing these critiques at the beginning really helped me conceptualize how to get that across. Because in your summary statement, you may look at it and think, oh my God, how am I going to fit all of this into 3 pages of an introduction to the application and talking about what the reviewers brought up? Not only that, but how I address their concerns. So it's a lot of information to pack in there. So you want to really iron out how to conceptualize things first. And then at the end, I made an action plan on how I was going to address these concerns for the resubmission. So that's just what helps me. So just some general strategies for grants success. You want to state the rationale clearly. You want to present an accurate and thorough review of the literature. I think with going back to stating the rationale clearly, I think you don't want to make any assumptions about your reviewers knowing what you're talking about. You want to make things very clear that whoever can pick up the application will understand things. You may want to get family members outside of science. I do this very often, reading your application to see if things are clear to them. That can always help, getting a fresh set of eyes. You want to include a power analysis. Never think that because you're doing a training grant, you don't need to do this. You always need to do this. You also want to be mindful about your career, that you need to publish regularly in high quality journals. to build up your biosketch. You want to be organized. I've hit on that a couple other times. Again, never assume the grant reviewers know what you mean. You want to create a story with your contributions to science in the new biosketch, and you want to ask others to review your application. You want to ask people within your lab, within your department, outside your field, as many people as you can get to agree to review your work, the better. You know, put your vulnerabilities aside here. You know, what you want to do is submit a great application, and the more people to give you recommendations or just tell you what's clear and what's not, the better. So I think there are a number of other grant writing resources. There's at your professional organizations, I mentioned at ACRM, you know, we have the early career development course where we often focus on grant writing. And as I said, we have all program officers from NIDILRR, from VA, from NIH, always talk about the different opportunities for early career researchers. So I highly recommend attending that. There's also the training in grantsmanship for rehab research, which is a one-week course at University of North Carolina. I attended this many moons ago when it was had a different name and a different institution, but it was really, really helpful. It was helpful for networking as well as grant writing. There's also these grant writers seminars and workshops. A lot of these are done over the web too, or at local universities, which are very helpful. So last I mentioned wanting to talk about these fellowship options at the VA. How do you get your foot in the door at the VA? So this is a website for advanced fellowship opportunities. There are many, many flavors of these. I did two different postdoctoral fellowships both from this advanced fellowships. A polytrauma TBI fellowship, it was like a mini training grant that you had to write, where you're developing a small research plan with your mentor, and you and your mentor submit it together. So you do have to identify a mentor and have an idea about your project beforehand. But then there are these other types. I did the health services research and development first, where Hines VA has a center of excellence for RR&D research, and that center of excellence hosts a fellowship which you can apply to, and with that you're applying to that center. You go through interviews with them, and then you develop your project after being, accepted into that program. So each of these different fellowships has a different flavor. So the polytrauma TBI fellowship, also there's a flavor for clinicians and one for researchers too. So I just really recommend, perusing this website and seeing if there's something that matches up with what you want to do, because chances are there is. And this is a different pot of money than the VA Office of Research and Development, and they have money to give. So these are not nearly as competitive as the Career Development Awards in the VA. So it's a really nice way to get your foot in the door, start to build a mentorship team within the VA. So I just wanted to plug that a little bit. So last, any questions? Okay, good. I have my email here as well. So any questions people want to take in the last 15 minutes? And of course, feel free to reach out via email as well if you have questions. And we'll also be posting the slides for the lecture, as well as I believe the archive lecture itself, on the ACRM website. All right, well, it sounds like we don't have, please feel free to, speak up. Well, it sounds like we're good, but I, definitely feel free to reach out via email, and feel free to reach out about, writing grants and transitioning from being in the career or being in the training grant writing stage to being in the, merit or R1 writing stage. That's my struggle right now, so I'm happy to entertain those questions and share my wins and losses with you. So thank you.
All right, thank you so much, Amy.
Thank you so much.
Like Amy noted, her slides as well as the webinar recording will be posted on the ACRM Early Career Networking Group website within probably, I think, by the end of next week. We're going to start having these quarterly, so our next webinar is scheduled for June 28th, and we'll be sending out more information about the topic and the speaker for that in the coming months. And if you have any ideas for presentations or topics that you really would like for us to cover, please feel free to email me. My contact information is also on the website, and we will look at covering all those topics that are brought to us. So thank y'all so much. Have a great Friday and a great weekend.
All right. Thanks, everyone.